You know how sometimes just a small thing, maybe in a routine test, can suddenly open up a whole bigger picture about your health?
Yeah, definitely.
Well, today we're diving into exactly that kind of clue. It's something called cylindruria, which can show up in a standard urine test.
Exactly. And cylindruria, basically, it just means finding an abnormally high number of what are called casts in urine sediment.
Casts. Okay, so what exactly are those in simple terms?
Well, they're microscopic structures. They actually form inside the tiny tubes within your kidneys.
Yeah.
Think of them like little molds that take on the shape of those tubes.
Right, okay, a little mold. And I guess finding some isn't necessarily weird, but lots of them,
Mm-hmm.
that's different.
Precisely. Finding a high number isn't just, random. It's often a sign, kind of a subtle signal that something's going on with the kidneys.
Either directly in the kidneys or maybe something systemic affecting them.
Yeah, exactly. It could be either.
Now, for this deep dive, we looked at some medical texts, specifically focusing on this in dogs and cats.
That's right.
And listeners might think, okay, animal health, but the underlying principles, they're relevant for us too, right?
Absolutely. It's actually fascinating how the fundamentals of, how kidneys work and how these casts form are so similar across mammals, including humans.
So studying it in animals gives us real insight into our own bodies.
It really does. It helps understand how our bodies signal potential problems.
Okay. So our mission today really is to get a handle on what these casts mean, what causes them to show up in high numbers, and why it's actually, a pretty important piece of the health puzzle.
Sounds good.
All right, let's get into the basics then. You said abnormally high number. What does that mean technically? Like how many is too many?
So the sort of official definition, it's finding more than, say, 2 or 3 casts per low power field when you're looking at the urine sediment under a microscope.
Two or three. So seeing more than that consistently is the issue.
Yeah, that's generally not considered normal.
And what's the big picture significance? If you see more casts, what's likely happening?
Generally, it's just a few possibilities, maybe accelerated degeneration of kidney cells or um, protein leaking from the kidneys filters the glomeruli,
Okay.
or it could be bleeding within the kidney, or even inflammation,
Yeah.
like exudate getting into those kidney tubules.
So it's a definite indicator of some kind of kidney stress or damage.
A strong indicator, yes.
And just to reiterate, even though our sources are animal focused, these principles apply more broadly.
They really do. While the specific triggers might vary a bit between, say, a dog and a human, the basic message of cylindruria that the kidneys under stress holds true. Kidney function is remarkably conserved across mammals.
Nature found a good design and stuck with it, huh?
Pretty much, yeah.
All right, let's dig into the why then. What actually causes these elevated CAS numbers? I know our sources break this down.
Yes, they do. The first major category is something called nephrotoxicosis.
Which basically means kidney damage from toxins, right?
Exactly. Poisoning, essentially.
What kinds of toxins are we talking about, especially thinking about those dog and cat examples?
Well, some common ones, unfortunately, are things like ethylene glycol, antifreeze.
Ah, yes. Very dangerous.
Definitely. Also, grapes or raisins for dogs, which people might not realize are toxic.
Right. That's a surprising one for many.
And lily ingestion for cats is another big one. Even things like hypercalcemia. Too much calcium in the blood can act like a toxin to the kidneys.
Wow. It shows how everyday things can be risky. What about medications? Can they cause this too?
Oh, absolutely. A whole range of drugs could be nephrotoxic. Things like certain antibiotics, aminoglycosides, for example,
Oh.
some chemotherapy agents like cisplatin, even common things like NSAIDs if used improperly, or the contrast dyes used for some X-rays or CT scans.
So a wide variety of substances. It really highlights how sensitive the kidneys are.
It does.
Okay, so that covers toxins. What's the next big cause?
The next major category is renal ischemia.
Ischemia meaning not enough oxygen.
Exactly. An insufficient supply of oxygenated blood getting to the kidneys. They need that constant flow, just like any organ.
And what leads to that? What stops the kidneys from getting enough blood or oxygen?
Well, dehydration is a really common one. Less fluid volume means lower blood pressure and flow.
Makes sense.
Also, low cardiac output. So if the heart isn't pumping effectively, maybe due to heart failure or an arrhythmia,
Then the kidneys don't get enough blood.
right? And then you can have actual blockages like a blood clot in their renal artery or vein.
Where would those clots come from?
Sometimes from infections elsewhere, like bacterial endocarditis and infection on a heart valve, or from systemic clotting disorders like DIC.
Okay. Any other causes of ischemia?
Yeah, there are conditions that cause rapid breakdown of red blood cells, releasing hemoglobin, or muscle tissue breakdown, releasing myoglobin. These substances can kind of overwhelm and damage the kidney tubules, contributing to oxygen issues too.
That's a lot of potential pathways to kidney oxygen starvation. Okay, what's the third main category?
Renal inflammation.
Mhm.
So this is where the kidney tissue itself gets inflamed, often due to infection.
Can you give some examples of infections that might target the kidneys like that?
Sure. Things like pyelonephritis, which is a bacterial infection right in the kidney.
Okay.
Leptospirosis is another one, a bacterial disease that can hit multiple organs, kidneys included.
Right, I've heard of that.
And then feline infectious peritonitis, FIP, in cats. Also, some tick-borne diseases like Rocky Mountain spotted fever or ehrlichiosis can cause kidney inflammation.
So infections are definitely a key cause. We've got toxins, lack of oxygen, inflammation. Is there another big one?
Yes, the fourth main category highlighted is glomerular disease.
Affecting the glomeruli?
No,
Those are the filters?
exactly. The tiny filtering units within the kidneys. So these are diseases directly hitting those filters.
Like what kind of diseases are we talking about?
Two main examples given are glomerulonephritis, which is basically inflammation of those glomeruli,
Okay.
and amyloidosis, which is a buildup of abnormal proteins in the kidney tissue. Both mess up the filtering process and can lead to casts forming.
So, wow, cylindruria can point to a really wide range of problems. When this finding comes up, how do doctors or vets figure out which problem it is? What else do they look at?
That's crucial. The cylindruria itself is just one clue. You have to look at the whole picture.
The clinical context.
Exactly. The patient's history is super important. Did they get into antifreeze? Are they on certain meds? That points towards toxic damage or acute tubular necrosis.
Right.
Have they been vomiting or had diarrhea? That suggests dehydration, maybe leading to ischemia.
Okay.
Even recent anesthesia for surgery can sometimes cause temporary ischemia.
Huh. Interesting.
And obviously, any known exposure to infectious diseases makes you think about nephritis, kidney infection.
So, history is key. What about the physical exam? Any specific findings that might help?
Definitely. A fever, for instance, could suggest infection, inflammation, maybe even some cancers.
Uh-huh.
A new heart murmur, especially a specific type called a diastolic murmur, could indicate that bacterial endocarditis we mentioned.
Potentially seeding clots to the kidneys.
Exactly. And seeing things like petechiae, tiny red spots, or bruising on the skin could suggest a systemic clotting issue.
Okay. Now, our sources also mentioned urine concentration, the specific gravity, as being important. How does that fit in with the casts?
It's very helpful. Let's say you have cylindruria and azotemia. That's the buildup of waste products like urea and creatinine in the blood.
Okay, so high wastes plus casts.
Right. Now, if the urine is also very concentrated, high specific gravity, like over 1.030 in dogs or 1.040 in cats, it might mean the problem is before the kidneys, like dehydration. The kidneys are still working, trying to save water.
Ah, okay. Pre-renal azotemia.
Exactly. But if you have the casts and the azotemia and the urine is dilute, meaning the specific gravity is low,
Below those numbers.
yes, that strongly suggests the problem is in the kidneys themselves. They've lost their ability to concentrate urine properly. That points more towards intrinsic kidney failure.
That's a really neat distinction. Very useful clinically. What about other lab results? Blood tests, other urine findings?
Yeah, other findings add pieces to the puzzle.
Mm.
High white blood cell count, leukocytosis, along with casts, makes you think infection or inflammation.
Makes sense.
Low platelet count, thrombocytopenia with casts. Could signal one of those clotting disorders, like DIC,
Okay.
and finding glucose in the urine glucosuria, or protein in the urine proteinuria alongside the casts. That can be a strong sign of damage to the kidney tubules themselves, tubular necrosis.
So it's not just that casts are present, but the type of cast can give even more specific clues.
Absolutely. The morphology of the cast tells a story.
Like what?
Well, if you see epithelial casts or granular casts or waxy casts,
Mm.
those usually point towards degeneration, death, and shedding of the cells that line the kidney tubules.
Okay, indicating tubular damage. What about seeing red blood cells within a cast?
RBC casts, red blood cell casts,
Mm-hmm.
is generally a more serious sign. It typically means either severe damage to the glomeruli, the filters, allowing red cells to leak through,
Right.
or actual hemorrhage, bleeding directly into the tubules.
Gotcha. And white blood cell casts?
WBC casts usually signal inflammation within the kidney. The sources note they're often linked with pyelonephritis, that kidney infection.
Okay.
But interestingly, the text also points out that many cases of pyelonephritis don't actually show WBC casts.
Oh, really? So you can't rule it out just because you don't see them?
Exactly. It's
Yeah.
one of those nuances. Their presence is suggestive, but their absence isn't conclusive.
Good to know. What about hyaline casts? Are they common?
Hyaline casts are probably the most common type. They're mainly protein. You often see them with proteinuria, protein in the urine.
Uh-huh.
But they can also show up just with increased urine flow, like during diuresis or even just with dehydration. So they're a bit less specific, but still part of the picture.
Okay. And looking beyond the urine, what other changes might show up in general blood work when cylindruria is happening?
Well, depending on the cause, you might see things like anemia or the opposite, hemoconcentration, where the blood looks thicker due to dehydration.
Right.
You might see that elevated white count, leukocytosis or the low platelet count, thrombocytopenia we mentioned. And of course, if there's dehydration or kidney disease, you'll usually see those elevated kidney waste products, BUN, creatinine, phosphorus.
So if the initial tests, the history, exam, basic labs, urinalysis with the casts point in a certain direction, are there more specialized tests?
Yes, definitely. If things point towards a clotting issue, maybe low platelets or those RBC casts, then coagulation tests, PT, PTP, FTP, D-dimers might be run.
Okay.
If there's significant protein in the urine, a urine protein-creatinine ratio, or UPC, is done to quantify it.
To see how much protein is being lost.
Exactly. If infection is suspected, especially with white cells in the urine, then a urine culture is key to identify bacteria and choose the right antibiotic.
Makes sense.
And if a systemic infection like leptospirosis or a tick-borne disease is on the list, then specific blood titers can be run to look for antibodies.
And what if, after all that, the cause is still unclear, but the kidney issue persists?
In those more difficult cases, if the kidney disease isn't resolving or the cause is still murky, a renal biopsy might be the next step.
Which involves taking a small sample of kidney tissue.
Yes. It's more invasive, obviously,
Yeah.
but looking directly at the tissue under a microscope can provide a definitive diagnosis sometimes.
Okay. So let's shift to management. Once cylindruria is found, and hopefully the underlying cause is identified, is it treated? Is there one approach?
No, not really. The treatment is entirely dependent on fixing the underlying cause. There's no specific treatment for cylindruria.
Right. You treat the cause, not the sign.
Precisely. The source does mention, deciding between outpatient care if the animal is stable versus hospitalization if they're dehydrated or in significant kidney failure.
And what about supportive care? What's usually involved?
Hydration is almost always key.
Yeah.
If it can't drink enough, fluids are given, either intravenously or sometimes under the skin, subcutaneously.
Okay.
And if it turns out to be chronic kidney disease, then special therapeutic diets are often recommended long-term.
Are there things that should absolutely be avoided, treatment-wise?
Yes. The big one is avoiding any potentially nephrotoxic drugs unless they are absolutely essential and can be monitored very closely.
Which loops back to knowing about those drug risks we talked about earlier.
Exactly. It's critical.
And finally, thinking long-term. If cylindruria is detected, what's the general outlook?
It really varies hugely depending on the cause and how much damage occurred before it was caught and treated.
So permanent kidney disease is a risk.
It is, unfortunately, a possible complication. The source emphasizes that preventing it in the first place is key, avoiding those toxins, preventing severe dehydration or situations that reduce kidney blood flow.
Okay, so wrapping this up then. The big takeaway seems to be that cylindruria, finding these casts in the urine, isn't just some random lab finding. It's a significant flag.
A really important one. It signals that something is stressing the kidneys, whether it's toxins, ischemia, an infection, or direct kidney disease. It demands investigation.
It really does. And you have to look at the type of cast, the other lab work, the history, the whole picture.
Absolutely. You piece it all together.
And even though we use those animal health examples, the underlying biology, the way kidneys react and signal distress through these casts, it's incredibly relevant for understanding our own health, too.
It really is. It's a great illustration of how the body works and how interconnected everything is. These tiny microscopic structures tell such a big story.
It really makes you wonder, doesn't it? What other maybe seemingly small indicators our bodies might be giving us? And, how can we get better at noticing and understanding those subtle signals about our overall well-being?
That's a fascinating question to think about, definitely.